You can't prevent all the minor illnesses that are around, but you can protect your babies against some very serious infections with immunisation. In the UK, the routine vaccines begin at the age of 2 months, even if your babies were premature. Good hygiene is important too. While very few babies need to be in a completely sterile environment, they do need protection from common viruses and bacteria. Always wash your hands well before preparing feeds and after nappy changes, toilet visits, grooming pets or gardening. Now, it's unrealistic to keep away from everyone who might be carrying germs. Your babies would never leave the house if you did. But don't let anybody with flu or a streaming cold handle them. And be especially careful if an adult has cold sores. Here are my tips on coping with illness. Babies need a lot of TLC when they're unwell, and even minor things can be very trying when you have more than one. First, enlist all the help that you can. This is the time to call in favours and to get in touch with anyone who said they'd lend a hand. Maybe someone can cook or shop for you while you look after the babies. Make sure too that you think ahead before illness strikes, so that you're never left with an empty freezer. And make sure you've got the essentials for coping with minor illness, things like a thermometer, liquid paracetamol or ibuprofen. When your babies are ill, don't worry about your usual routine. It's much more important to keep them comfortable and happy than to stick to a regimented schedule. You can resume your normal way of doing things when they're better. Here are some more tips you might like to use. If your babies already sleep in a separate room, consider having them in your bedroom at night while they're unwell. This helps you keep an eye on them and attend to them promptly if, say, they vomit in the night. So move the cot in if you can. Don't overstimulate a poorly baby. Little ones often regress when they're ill. They're more likely to enjoy a favourite old toy or a cuddle with you and a quiet read of a well-loved story. Now, make sure you eat and drink regularly because you need to keep your strength up, and make sure you rest. Don't do housework unless you really, really have to. What about getting in touch with your doctor? Well, when you have twins, it can be much easier to have the doctor visit you at home. But bear in mind, you'll probably be seen a lot sooner if you can get yourselves to the surgery. Staff should be able to fit in babies and young children so they don't have to wait around. And if you're wondering, it usually does no harm to take a feverish baby outside. There may be times, of course, when you just want to speak to your doctor. Talk to the receptionist and leave a message. Most GPs can call you back at the end of a session, so that would be either late morning or late evening. Sometimes you just need to talk to them to find out if you're doing the right things. Remember too that health visitors can give you advice and tips on coping with minor illness.